So you might want to know how long a procedure of amalgam removal is going to take. That's a tough question to answer generically because everybody's so different. It also depends on what is it that we're trying to accomplish for you on that particular visit. Sometimes if it's just a single tooth, you might be in and out of the whole process in 20 minutes. If it's a more involved situation where we're doing 4 or 5 or 6 teeth in one visit, you may spend an hour or two, which is not unusual, for the whole amalgam removal process and then the refitting of some kind of a restoration back onto your tooth when we're finished, and then adjusting the bite, making sure things are happy. So it's it's not a procedure that we rush, and we have ample time scheduled for it. It just really depends on also how well you get numb. Is it a difficult thing for you to get numb? Some people are. Some people didn't get the message about not taking oral vitamin C. Some people come in and their bodies are very acidic to begin with, and the more acidic the body is, the more it's going to kind of negate the action of the anesthetic, because the anesthetics typically are alkaline or basic. The body being acidic just neutralizes the effect of the anesthetic. So there are some people that we get only 10 or 15 minutes of effective anesthesia out of. So depending on what your particular needs are, how your body is, you may be in the chair for as little as, say, 20 minutes up to 2 hours, and we've had people 4 hours or more. So it's really kind of a variable type of question. And whether or not a person needs to have somebody drive you home afterwards, typically for the amalgam removal process, that's never necessary. It's unless it's a child and you have to drive a child home. But there's no typical thing that you have a situation where your body is just not feeling good or anything. So you would just say goodbye and start your car and just drive on home.